Good morning. My name is Sainey Jabbi. As he mentioned, I'm someone with two names. Some call some call Sainey, some Sainey Jabbi. Now, my topic of discussion. I'm a midwife. I was a nurse before I work in the hospital. I work for the ladies from the time of non-conception to the time of conception. And the discussion of today will be STIs. So now STIs is this kind of, it will be kind of a discussion. Do anyone understand what STIs mean? Any idea what do you think about STIs? Yeah? Sexual transmitted disease. But technically, these are the definition where I used to have argument with people. And you are right, it's sexual transmitted disease. Because these are diseases that you can have through sex, but it should not be leveled by sex. I can tell you a lot of people is having this disease. They don't have it through sex. They have it through other means, such as during childbirth, a woman can be in labor, and the instrument is used that is infected with that. They can have it. Or simply you go to a hospital, they use an instrument that is infected, they inject you with, you can have it. You can have it in different ways. So that's why, I don't only base on sexual transmitted disease, but to expand to other areas. Like he mentioned, sexual transmitted diseases are caused by sexually transmitted infections. So they are interchangeable. STIs, STDs, they are the same. So it's mainly caused by sexual activities. But not only that, you can have it through blood during pregnancy and during childbirth, like I mentioned. And these STDs, they are caused by almost three things. That's a bacterial, viral infection, and parasites. But among all these three things, there are one that is very friendly. When we have that one, we don't mind that much. And do you know what is that? It's easy to deal with bacterial. We can fight with bacterial. We can talk with bacterial. But there are some, it's a problem. Like the virus, like the parasites. The parasite too is friendly. But that middle one is a problem. So example of bacterial infection are gonorrhea, syphilis, chlamydia, and viral we have HPV, herpes and HIV. There was a time that the country was doing vaccination on HPV. It was a countrywide. It was a concern. Hepatitis B, there was vaccination for hepatitis B. We just want to ensure that our people are safe. So these are common STIs in this country that we have recorded. They are very common. HIV, syphilis, yeah?
Before you go, I want to know, can you go back? Like this bacterial infection,
Yeah.
and syphilis. So what are the causes of and what are the media of them?
Wonderful. Yeah, yeah, that's wonderful. Yeah, no, yeah. The question you're asking is the next slide, but it's wonderful. I like asking questions. I like people to ask questions. That's how you like. Okay. Now, he asked a question. What are the signs and symptoms? Like, I talked about the causes. The causes are either bacterial, a virus, or parasites. But now the problem is how do people know you have STIs, you have STDs? Believe me, there are a lot of people that are having it. They don't have symptoms. You live normally, you don't have any problem, but you still live with this problem. There are people that are having symptoms. Symptoms like sore throat, mouth or rectal area, painful urination, discharge in penis or vaginal, abnormal bleeding, fever, rashes, muscle wastage, painful sex, lower abdominal pain. You have a lot of the presentation of it. But now, with people with this symptom, these are the people they can present with this symptom. Okay? Why do they have it? What are the risk factors? If someone can have HIV, The risk factors we will think. The common thinking of Gambian is sex. Yeah? Okay. So these are the risk factors of all that is mentioned. These are unprotected sex, multiple sexual partners, a history of STIs, substance abuse, and young age. So now, unprotected sex, why can someone be at a risk? That's a question. The problem is that the partner that you are having, you don't know the fate of that person. Or maybe yourself, you don't know the fate of that person. And I told you there are some girls or boys that are very, very healthy by appearance, but somehow they have this sickness you might not know. In other way, you will get it, and you will not even know how you get it. But if you know that if you are engaging in unprotected sexual activities, my brother, you are at a higher risk, or my sister, you are at a higher risk. Multiple sexual partners, they are not a problem. Polygamy is not a problem, but it's important that the fates are known. If any man that have multiple sexual partners, believe me, he will not. He must have distance. It's very high risk, very, very high risk, because some people they think it's only sex, but anal sexual activities is really a problem in this country. There are people that are engaging in such activities, and people can have a true oral. So substance abuse, those are the people that are using chemicals, like let's say for instance needle. It's not very common, but people that use drugs, they go to the hospital, they ask of needles. Sometimes if you don't give the needles, they will find a way, or we can give the needle, they will be using all of them. One will use it, the other one will use, the other one will use it. They are here. There are people that always come to the facility. They will just ask, even use one, they will just say, even they use one. You might not give them, but somehow they might get it, or they might buy it from the pharmacy. Okay? Some have it through that. And younger age. So this younger age of 15 to 24, this is a point where men or women want to explore. They want to know what is behind the wall. They just want to, they have an idea, but they want to know how sex feels. They want to know how this feels. And these are the moment when they think like, I am the princess or I'm the prince. So they want to discover. So within this age gap, a lot of unwanted pregnancy fall under this age gap. Within this age gap, a lot of STIs fall under the same age gap. Okay. Now, I wanted to do reproductive health issues and STIs. When we talk about reproductive health, we're talking about especially the women's. And I want to connect with STIs. Why STIs are important? Because if you have an STIs, it can make you unable to give birth. That applies to both male and female. Okay? And if you have STIs, like it can make you to have a pelvic inflammatory disease. These are diseases that is inside the pelvic. We have a lot of organs there. The egg, the ovaries, where it fertilized, is inside that pelvic. So if you have STIs, it's always inside there. Every month you might see your mens, but it's just a wastage. And some people get infertility because of this STIs. That probably can be treated, but maybe you don't know. There are people that are married for thousands of days or months, they still cannot have child. When they go to the hospital, this is what we first rule out. These are some of the things that we rule out. We want to confirm that they don't have this. So people with HPV, this country has tried to vaccinate as much as possible, because HPV causes cervical cancer. And when you have this cervical cancer, we just remove the uterus. That is not like it's high, almost impossible for you to have a child. So these are preventable things. And they are asymptoms. Sometimes they don't give you symptoms. And these are concerning. You can have ectopic pregnancy. Because remember, your uterus where the sperm and the egg, when they meet, where they implant, if that place is having infection, no, it's very difficult for it to embed the fertilized ovum. Then it goes outside that. When it goes outside that, either you take medicine or they go for it to remove it. and miscarriage. Lot of miscarriage are caused by STDs. At our end, we have seen a lot of cases with STDs that hardly go with their child. Let's say 3-4 months, baby come. 3-4 months, baby come. It become habitual abortion. But the beautiful thing about it, most of the time, is preventable. Okay. Now, we link STIs with the infant.
Like we are answering this question, most of them are can you go up this?
Yeah.
Like
Yes.
like this cervical cancer and this BLD disease.
Yes.
Someone because you go
Yes.
irregularity in family.
No. You know the problem? It's a very big topic. Cervical cancer. Cervical cancer can be caused by a HPV virus. It's a viral disease, a viral infection that causes it. But HPV is an area of its own. It's a viral infection that women can have, men can have, and you can have it through sexual activities.
But we normally, who normally have this disease like this BLD?
You see, the pelvic inflammatory disease, women usually have it. Yes, that's for women. Okay? And infertility, that is for you, me, and women. Okay? And then we have in cervical cancer, cervix is for the female. And the virus that they have is both male and female can have it. It's not only for them. STDs, we have a lot of STDs. Now, I wanted to link between the spread to infant. You see a baby that is inside that womb. If a woman is having STDs and the woman is not being treated, that STDs can be transferred to the child. And when we talk about these STDs, let me just tell you, let's say now, let's narrow it, HIV. Maybe the understanding will be there. If a woman has HIV and the HIV is not being treated, the child will be born with HIV. What will happen? HIV population will increase. And that child survival is very minimal because everyday sickness. Everyday sickness. So you see how STDs can be linked to the infant that is inside the stomach, because there are some viral that can be transferred through placenta. They can still have that. That's why we say STD can be transferred from mother to infant during pregnancy and childbirth. We give them medication. If any woman that is having HIV, we give you medication purposely to prevent the child that is inside. And even they come to the hospital, if we are conducting delivery, we make sure to be very careful so that we don't mistakenly transfer to the child or yourself. Okay? Now, this safety precaution make us to screen every woman that come in contact to the facility. Any woman that came for booking, we have to ensure that they are free from some common STIs like HIV, like syphilis. These are tests that are done for them. But remember, it's only the female. The males, we don't have access to them. We talk about Bundung. Bundung will give you a policy that if you don't bring your husband, he will not see you. It's not compulsory, it's an idea to bring the men there. So the men can be tested, the men can understand what this thing goes on. Okay? Now, STD and maternal mortality. The link of STD and maternal mortality. When you talk about maternal mortality, it's like a pregnant woman that died from the time of birth to 6 months, 6 weeks. Okay? But now, see, the infection increase pregnancy complication. You know, Mr. Dow mentioned there, whenever every pregnancy is a risk. That's why people with other diseases, we call it high risk. Like hypertension, we call high risk pregnancy. But every pregnancy is a risk because your system work extra, your heart work extra, everything about it, even your weight will increase, even your face will increase, everything change. That's what pregnancy is. Okay? But now, if you are pregnant, it's causing more complication. There's a risk of you having a lot of complication. Okay? And like I said, during pregnancy, you can have some disease like HIV. You can have like syphilis. And this one, if you have it, most of the time the child will be born with no life. I have conducted deliveries of such, and inside we know prior before the child will be born, we know that there is no life. The child have already, passed off in the stomach. And this is the major cause, is especially HIV is a major cause of it. Remember 9 months. You either you are not being screened or you've been screened but you refuse to take medication, and that mistake harm the child, and the child is normal. Before, there is no way that you can save the child, but now technology, there is a lot of if you have, but we can prevent the child not to have. And also delay in seeking care. If you're having STDs, please seek for care. Either you are pregnant or you are not pregnant. This applies to both male and both female. The reason why I mention this, especially male, are always asymptom. You can check them, most of the time, they will never have symptom. They will never experience lower abdominal pain. They will never experience discharge, penile discharge, and they still have it. That's why we always believe in partner treatment. Once one partner have, then we treat both of you. You don't need to go and test you. We just treat both of you to ensure that everyone is saved. So delay is a problem. A delay can cause infertility. A delay can cause first stillbirth. The child will die immediately if the child is born. A delay can make your pregnancy be higher risk. Now we have challenges of this. Like I said, HIV is just one of STDs, but it's the thing that is hard to say. You will never see someone who will tell you, I have HIV. You will never see about that. Because why? Why people don't even disclose their faith? That's the question. You know why? That's stigma. If one mistakenly disclose his status, believe me, you might not even shake a hand with the person. You might not, because of the stigma. And also taboo. So this taboo is a problem. Before HIV, there was things that are associated with it. People don't believe in HIV before. HIV have taken a lot of lives. People don't believe it before. They associate it with certain things. Any sickness you see, we will give a name to it. Okay, we will give a name to it. There is something that we attach to it until we believe that, yeah, this is the thing. Okay. So now, and secondly, lack of youth-friendly health service. This is also a challenge, especially for HIV patients. Maybe healthcare workers will know we have a higher population of them that will never be disclosed. We inject them, we discuss with them, but let's not forget. Let's forget HIV. Let's talk about STDs within ourselves. Do we really talk about it? Do we really concern about that? That's the main point. Because we are always afraid of HIV. Hepatitis is taken. Hepatitis is increasing, and that is also a concern. Now we also have limited sexual education in school. So this is a problem. Who remember POP FLE? I was a course in POP FLE. They are trying to educate people about sexual activity, sexual life. But this sexual life, some people might abuse it, yes, that's part of it. But some people might take a better knowledge in it. This one is making you aware of sexual activities. If you engage, this is the risk that you can have. If you do this one you can have. I think that's a right course. I don't know why it has been kind of suspended or removed. And also, in access of treatment, most of these STDs, they are very expensive, especially HIV medication. That's why we always tell our people that these medications are expensive. Take it with cautions. Most of them, if you have it, this country provided for you. They will care for you. The problem is not coming or having it and being denial. We have people, when you tell them I have HIV, or those people, it takes time before they accept. Although it depends on how you counsel them. But sometimes you have people that just deny. They just deny. They will never take the medication until high complication occur. Okay. Now, do we have a preventive strategy to this? Yes. Like I said, we can prevent STDs. But how can we prevent STDs? Is to make such activities like this, educational activities. Let's talk about HIV. Let's talk about syphilis. Let's talk about gonorrhea. Let's talk about all these major STDs. Let's talk about how one can be prevented. And as soon as possible, when and how can you go and check yourself on this? So that one is really, that will really help. We can also use condom promotion and access. We realize that you cannot stop people from accessing what they want. You cannot stop them from doing these activities. But what we can help them is to make this condom accessible. But you know, we are in a country where if you make this inaccessible, you might be seen like someone who is promoting sexual activities. But now this, we are not, in fact, this condom promotion is not basically on the pregnancy, but on how to avoid the STDs, how to avoid sexual transmitted infection. That's our main ideas. If you want, if it's pregnancy alone, that's fine. Pregnancy, no matter what, if it's, you don't want it, it can be removed safely. But this other one, if you have it like HIV, there is no treatment. So this is the concern, okay? And regular screening and treatment. There was a time I had a lectures, I was asking these questions. When was the last time that you went to the hospital and you told them, I want to do screening, I want to check on myself, especially the STDs? No, hardly you see one people who will say, I did it, I did it. The only time some people do it when they go for blood transfusion, because we cannot take your sample to give it to someone when we don't confirm that this and this and this and this is there. So it's very difficult. You see, the only time we have contact with people that either they are sick or they want to travel, they need some medical paper, no, something brought them there. Okay, so that has to stop. I always tell people every 6 months, your HIV status, your hepatitis status, these are basic tests. Most of them are free. You can go to any hospital, any health center, they will do this test for you. And once you know your status, you are helping it reduction. We want the population to reduce. We want to eliminate this, and it's possible. HPV vaccination. This vaccination has been going on. At our end, in fact, it's been given to kids, children at the primary school and junior school. It was very famous. We have people, parents who will call you, they will tell you, I don't want my child to be vaccinated. I was among the team that, no, we don't want vaccination. But the problem is that they don't understand what kind of vaccination that child should take. They don't understand. So we have to intervene, talk to them, we have to visit them, tell the parents what and what and what. The moment they understand, they accept. So sometimes, you know, the understanding gap between the caregivers and the receivers sometimes is not sufficient enough. Now, we want to empower girls. Like I said, from the age of 15 to 24, that's where everything started. But that age, if the girls are empowered, I think we will be able to minimize early sexual activities. The idea is how to minimize that early sexual activities. And also how to minimize drug usage. Drug usage is not a big problem here. We don't use parental drugs like cocaine and others that you inject. It's still here, but not that common. Okay, it's not a problem. Now, this is the point that I will throw back to you. That is, what are the roles of mothers and the students when it comes to STD management? I count myself as a student, and I count every female as a mother and a sister. What can we do? Not what nurses or midwife can do. Nurses and midwife, we are in the hospital. We go outside to sensitize. But what can you do in order to reduce or to prevent STDs? Like for instance, my brother is here, attended this session. Maybe his friend is not here. Okay, it would be a good for him to advise his friend or his wife or his partner. Yes, I think it's important that we go and do some checkup, because nowadays it's not easy. No, this and this. He will be able to convince someone to go and to know his fate, to know his status. And by doing so, if this he did it, this one do it, this one do it, you'll be able. Let's say we have 10 people here. If these 10 people go out and try to influence another 10 people, another 10 people influence, I'm telling you, in 2020, in a short duration, actually, we will be able to raise awareness of STDs. Also, practicing safe sex. So safe sex is a sex with condom, or knowing the status of your partners. If you don't have STDs, your partner don't have STDs, it's safe. It's not a problem. But so long you don't know that girl's fate, and the girl don't know your fate, my brother, is a risk you're taking. It's a big risk you've taken. So we encourage people to use condom if you're gonna engage, and we avoid them to explore children's. No matter what, no matter how, we avoid them. We also seek for medical help, and whenever we see stigma, let's break it. Mr. Dow explained about something like fistula. There is a time when a woman delivered, there will be an abnormal hole that will come either from the bladder or the anus. These are having a problem. But now there is a campaign. These people are catered now. Anytime you hear someone with a fistula, there is a special program for them. In fact, they are trying to, even after the treatment, they will give you a startup business for you to start a business. They will empower you, they will visit you, they will ensure that you are okay. So stigma should not be anymore. And let us not be an agent to cause this stigma. All right, then the conclusion will be, we raise awareness on the prevention of STDs. And also we do regular screening, and we communicate, especially to our partners. These are very significant. I don't know how many people are married here, but I pray that